guy Bendu coming at y'all with another video today. So I wanted to get into this healthcare article that I know a lot of you saw. So as a lot of us know, this is no surprise, no shocker or anything like that. The United States ranks dead last whenever it comes to healthcare, opposed to the rest of the developed world, the developed world, the first world. It's crazy how, Western countries come up with these like terms to basically like separate themselves from the plebs of the global South. But first world countries, like, it's crazy that the United States is like one of the main people designating this like first world, third world terms, where like you literally have third world conditions in part of the United States. Nobody ever says shit. Our whole healthcare system, there's some third world countries and some countries like under economic siege, like Cuba, that have better healthcare systems than the fucking United States. That's fucking insane to me. So let's go ahead and get into this article though. All right. Stunning new report ranks U.S. dead last in healthcare among richest countries despite spending the most. If healthcare were an Olympic sport, the U.S. might not qualify in a competition with other high-income nations. This is by Joseph Guzman from The Hill. This is from The Hill. So let's go ahead and go through this video first.
The U.S. healthcare system ranked last among 11 wealthy countries, despite spending the highest percentage of its gross domestic product, 17% of GDP, on healthcare, according to an analysis by the Commonwealth Fund. Researchers behind the report surveyed tens of thousands of patients and doctors in each country and used data from the Organization for Economic Cooperation and Development and the World Health Organization. The report analyzed 71 healthcare performance measures under 5 categories: access to care, care process, administrative efficiency, equity, and healthcare outcomes. The U.S. also ranked last in 4 out of 5 categories.
That's insane. And again, we're a first world country and we have third world conditions in the fucking United States. So the story at a glance. The report analyzed 71 healthcare performance measures under 5 categories. Norway, the Netherlands, and Australia were the top performing countries overall, with the U.S. coming in dead last. So that was one of the things that Matt Bender was talking about in the debate with the Convo Couch. One of the things I remember him saying was, "Oh, Tulsi was worshiping this fucking this Australian model of healthcare, blah blah blah," and things like that. Where it's like, dude. And he was like talking about that, that's not like the NHS. Like he was trying to be like, for me, I'm looking at, I've like looked at the different healthcare systems around the world, and I feel like one that the American people would agree with is more of a obviously I'm Medicare for all. I'm for Medicare for all. But it's like when I look at when I explain the different healthcare systems to people, and I show them the healthcare systems around the world, like not even just on this channel, but in private, when I'm talking to like family members, friends, people that aren't on board with socialized medicine and shit like that. Like, I use the NHS to explain to them what full on, damn near full on government control of it will look like, as opposed to something like Australia, where Medicare for all, that's more of like the Australia, closer to the, it's not exactly like it, but closer to the Australian, like French model and things like that, where you're not going to see, as Jimmy Dore would say, you're not going to see a G-man, you're not going to a government doctor. It's, you're going to see your fucking doctor. It's just that literally it's as simple as this. You go see your doctor and the government writes a check and you don't have to worry about it. Point blank period. That's what it is. That's what Medicare for all is. So, I wanted to bring up the Matt Bender thing because he was like saying like the Australia model was like this capital, like dog, like it's still better than our system and almost everybody's covered there. So what are you talking about right now? So the U.S. ranked last on access to healthcare, administrative efficiency, equity, and healthcare outcomes, despite spending 17% of GDP on healthcare. The U.S. healthcare system ranked last among 11 wealthy countries, despite spending the highest percentage of its GDP on healthcare, according to an analysis by the Commonwealth Fund. And I may do a separate video where I actually like go through the study and shit, but I just wanted to read through this article. Researchers behind the survey Researchers behind the report surveyed tens of thousands of patients and doctors in each country and used data from the Organization for Economic Cooperation and Development and the WHO. The report considered 71 performance measures that fell under 5 categories: access to care, the care process, administrative efficiency, equity, and healthcare outcomes. Countries analyzed in the report include Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, the United Kingdom, and the United States. Norway, the Netherlands, and Australia were the top performing countries overall, with the U.S. coming in dead last. The U.S. ranked last on access to healthcare administrative efficiency, equity, and healthcare outcomes, despite spending 17%. So hold on. But came in second on the measures of care process metric. The nation performed well in rates of mammography screening and influenza vaccination for older Americans, as well as the percentage of adults who talk with their physician about nutrition, smoking, and alcohol use. Now, note, for older Americans, not younger Americans, like I'm 25 years old. If I was able to, consistently afford and go to my doctor to keep up with my health, I would. And I'm somebody, I'm in more of a blessed situation than most people. If most young people had the type of access and affordability to healthcare that a lot of these other countries would, we would have a way healthier country. People like to talk about, what about personal accountability, blah, blah, blah. Like, stop eating McDonald's, stop doing this, stop doing X, Y, and Z. Well, like most, there's a lot of people that want to lead better, healthier lives. But the simple matter is they just can't fucking afford to. And one of the aspects and components of that is access to healthcare, being able to keep up with your health, and not just physical health, but mental health as well. But most of the, things that people talk about is the physical health aspect, like how we have a large obesity problem in the country. I'm contributing to that. but overall, if people had access to this shit, they would go in a heartbeat. And it's like the crazy part is when people tell you we can't afford these types of programs, they're literally telling you we can't afford cheaper healthcare in terms of Medicare for all. It's insane. It's insanity. And like Fiorella said, Medicare for all is the middle ground. Because like most people that, most leftists, like people like me, we just want the full on like NHS, but even more than that, complete control of the healthcare system by the people owning it. But unfortunately, the government, you can't trust, certain aspects of the government with that complete control right now. And, it's so many like pitfalls within what's going on with healthcare and the conversation around it, that once you say, once you have to explain this to people properly. You have to show them, like I'm thinking about doing like a whole playlist about Medicare for all. Talk about it so I can be able to like share this playlist with somebody if I'm out and about or whatever, if I happen to get into a conversation, because I feel like most people don't understand this shit. Most people haven't seen these numbers that we're looking at. So, but again, they're talking about older Americans. If young people had, the same access that most older people have, we would be going to the doctor and living more healthy lives as well. Half of lower income U.S. adults in the report said cost prevented them from receiving health care, while more than just a quarter of high-income Americans said the same. In comparison, just 12% of lower-income residents in the UK and 7% with higher incomes said cost stopped them from getting care. The U.S. also had the highest infant mortality rate and lowest life expectancy at 60 compared with other countries. Literally, Cuba has a higher life expectancy and lower infant mortality rate than America. And that's with the economic warfare we're conducting on them. America is changing faster than ever. Add changing to your America. That's a ad. Researchers said several key factors to set high-performing nations apart from the U.S. Universal coverage, the removal of cost barriers, investment in care systems to reduce inequities, and investing in social services for children and working age adults. If healthcare were an Olympic sport, the U.S. might not qualify in a competition with other high-income nations. Eric Schneider, the lead author behind the report and senior vice president for policy and research at the Commonwealth Fund, told Changing America. The U.S. has two healthcare systems. For Americans with the means and insurance to have a regular doctor and reported experiences with their day-to-day care are relatively good. But for those who lack access, the consequences are stark, Schneider said. The poor performance is nothing new, as the U.S. has landed in last place in all 7 studies the Commonwealth Fund has released since 2004. So yeah, there you have it. I'm going to find a report and do a separate video specifically, and go through the numbers of the report. But that's not surprising to people like us, though. The people that are in the know, that report's not surprising. It's not telling anything new. It's just, we still can't have a conversation on Medicare for all, even, with the pandemic. And we still can't get Congress people to fight for Medicare for all during a pandemic. Some of us celebrate politicians for getting an eviction moratorium and shifting the Overton window further right, when literally, and Max Blumenthal brought this up. They were out there, Max Blumenthal and a couple other people are out there doing, car caravan protests for rent cancellation. And Cori Bush goes out and does her protest for a rent moratorium. And what she got was a lesser moratorium that was, a lesser moratorium than the moratorium that came before, which the original moratorium was shitty to begin with. So she got a shittier eviction moratorium, a targeted eviction moratorium that still leads to people getting kicked out of their fucking houses. But we're going to play music now. That's what they did when Franco, they yelled when Franco was challenging AOC. What are you going to do for healthcare, Franco? I don't know. I don't have the power. You should ask her. Who has the power to do something? Who, if she votes as a block with, a couple of the people that's already out here and gather up the rest of their cohorts, they can make something happen. But no, ask me, a citizen journalist who's asking a politician a worthy question, challenge me about what I'm going to do. Somebody with no power. What am I going to do? Go figure. That is why the United States will, and for a very long time, come dead last in healthcare because of shit like that. So with that being said, I'm going to go ahead and close the video out there, guys. As always, like, comment, subscribe, and share. Emphasis on all that. And yeah, thanks for tuning in. Peace. Peace.